The dynamic nature of ICU will always result in huge inconsistency in patient care. This includes doctors' differences in experiences and background of practice. A protocol-driven healthcare intervention will ensure effectivity, uniformity, and efficacy of care. Electrolyte imbalances are common in ICU patients with devastating outcomes. Treatment varies because of ICU dynamic of care, specifically doctors' preferences and ICU workload. Hence, uniformity must be considered. This presentation aims to explain the mode of electrolyte replacement in critically ill patients as my basis of research, explain the mind gap, identify two structured research questions, develop research strategies, explain the appropriate research methodologies that will be used to investigate these research questions. The mind gap revolves around the electrolyte imbalance. Research will focus specifically on hypokalemia, hypomagnesemia, and hypophosphatemia, and how they will affect the ICU patients physiologically. Subsequently, looking at the treatment and replacement modes such as the physician-driven and the nurse-initiated protocol-driven electrolyte replacement, and what are the hindrances for this. Finally, testing whether which treatment is more efficient and whether the protocol is accepted by the nurses. Hence, my few questions are, in electrolyte imbalance critically ill patient, is nurse-initiated protocol-driven electrolyte replacement versus the physician-driven electrolyte replacement is more efficient? And in electrolyte imbalance critically ill patient, is nurse-initiated electrolyte replacement has high acceptability between critical care registered nurses? I have identified the main concepts of this topic. The following are the main concepts of my topic, and I have considered these following synonyms in my literature research. These are the search techniques and keywords that I will be utilizing. EBSCO's database will be utilized, including Medline and CINAHL. In addition, search key articles in Scopus for references and citations will be used. Moreover, snowball searching for citations and references of key articles will be performed in Scopus. Duplicates will be removed. Search limiters such as the year publications should be between 2012 and 2022. Peer-reviewed, age group should be 18 and above. The language should be English. In the first research question, I will be utilizing a mixed methods experimental design because it will involve collecting and analyzing both quantitative and qualitative data and integrating the data collected within the intervention trial. A randomized controlled trial or RCT will be specifically used where participants will be randomly grouped into two. One will be utilizing the nurse-initiated protocol-driven electrolyte replacement, while the other group will be using the physician electrolyte replacement. Information such as the demographic data, diagnosis, number of electrolytes tests per day, number of low levels per day, number of replacement per day, time between availability of results to ordering replacement, time to starting the replacement, post-replacement levels, replacement dose, and replacement route will be collected. According to Kabish et al., RCT is best suited for researchers seek answer for safety and efficacy of new treatment. In addition, RCT will be determined whether there is a causal relationship between the intervention and the effect. The second research question, a qualitative method design will be used in order to examine the acceptability of nurses in a nurse-initiated protocol-driven electrolyte replacement, because this type of method must be utilized to answer questions about experiences, meaning, and perspective, usually from standpoint of the participants. There will always be significant inconsistencies in the way patients are treated because of the intensive care unit's dynamic nature. Therefore, problems such as electrolyte imbalances that usually occur in the ICU, the uniformity of treatment must always be taken into account.